In continuing coverage tonight, allergy medication sales are up at local drugstores. Many people are reporting symptoms such as cough and congestion. KNWA's Kylie Neal spent some time today learning about how the pollen count affects people's allergies around our region, and she joins us now live in the studio. So Kylie, why are so many of us feeling this way?
Well, Sonia, I really don't know, but I know that we have been experiencing 3 different seasons. In the morning, it feels like winter, and then it gets hot midday, and then it gets cold again at night. And what some people may be experiencing is seasonal allergies because of these changes. I spoke with some health professionals today about these changes because as the weather changes, your allergies might as well.
August to October, I'm having a lot of runny nose, itchy eyes, congestion, that type of thing.
Matt Bell is an allergist at Hedberg Allergy. He says that this is the time of year when he sees allergies spike, but that's not the only thing.
Also seeing a lot of respiratory viruses where, there can be a lot of overlap between the symptoms of viral respiratory illnesses, whether that's rhinovirus or enterovirus or even flu and COVID.
Bell says pollen rates fluctuating up and down is because of weather changes.
We are seeing a lot of allergic disease, but those also happen to be times when our viral respiratory illnesses are also quite prevalent.
Bell isn't the only one who sees the changes. Jo Johnson is a nurse practitioner at Mercy. She says she usually sees an uptick this time of the year, and most of the time it's treated pretty easily.
Most of the time we're going to treat with things like an over-the-counter. There's a lot of really good over-the-counter remedies available.
But with those over-the-counter medications, some of them can only help allergies. Johnson says that she sees an uptick in other illnesses as well.
This time of year especially, we're seeing an uptick in flu, we're seeing an uptick in COVID. And those are pretty simple tests that we can run in the office and determine, is that something that we're dealing with? Because if we catch those things early enough, there are treatments for them. We have, antivirals that we can use for flu and COVID if patients want them.
Bell says that Hedberg Allergy has seen the pollen levels fluctuate with the weather. And since the drought, ragweed levels could potentially decrease.
Hopefully this is the beginning of the end and not just a little lull in what we're seeing in terms of pollen counts right now.
And Bell's right. If you're wondering about the pollen count in your area, that information will be linked over on our website at knwa.com. Reporting in studio, Kylie Neal, KNWA, Northwest Arkansas News.